Welcome to the deep dive. Today we're jumping right in. Early childhood. What can it actually tell us about the risk of drug and alcohol issues later on in the teen years?
Exactly. We're digging into a pretty big chunk of research, mainly drawing on this 1991 overview by Randall Swaim.
Yeah.
It pulled together a lot of earlier work.
Right. So if you want the key takeaways without wading through tons of papers, this is the place. Our goal is basically to flag those early signs that research hints might be linked to later substance use.
hmm And it's really important to stress, this is about risk, not destiny. Identifying potential vulnerability, that's the key.
Definitely not predicting the future with certainty. So the original research, it used longitudinal studies, right? The ones that track kids for ages.
That's the one. Following the same kids over years. Super valuable for seeing how things unfold. And also some concurrent studies looking at traits and substance use at the same point in time.
Okay. And we're going to look at both the internal stuff, intrapersonal factors, and the external social stuff, interpersonal influences. Makes sense. So let's start inside the individual. This difficult child syndrome. What does that actually look like?
Yeah, it's a cluster of personality traits seen really early on. Think kids who are often in a negative mood state react really intensely, emotionally
Yeah.
speaking, both good and bad reactions.
Like big reactions to things and struggle to regulate.
Big reactions, yeah, and they find it hard to settle back down afterwards. Impatience, impulsivity, acting without really thinking things through, maybe shying away from new situations or people.
Okay.
Also, sometimes more rebellious, a really high need for independence, less likely to just conform or go along with things, and tied into that, maybe lower diligence, less focus on tasks.
And lower achievement orientation, the paper
It's
memo.
exactly, lower achievement orientation. And one really specific finding was about aggressiveness in young boys, early elementary age. If that was combined with shyness,
That seems counterintuitive.
it does. But that specific combination was found to be predictive of later drug involvement for boys. But interestingly, not for girls.
Huh. That specific combo is quite nuanced. Okay. What about kids who, had tough starts, maybe parents with alcohol problems, but turned out okay, resilient kids?
Oh, yeah, absolutely. Emmy Werner's work in Hawaii is classic here. She did a major longitudinal study on kids with alcoholic parents.
And the resilient ones, the ones who didn't develop serious problems, what set them apart?
Well, the main personality thing that stood out, looking back at infancy, they were overwhelmingly described as affectionate, cuddly babies.
Really, affectionate and cuddly. That's almost the polar opposite of the difficult child traits we just talked about.
Exactly, a really striking contrast.
Okay, so temperament seems key. Now, aggression keeps coming up. Pulkkinen's study in Finland, what did that show?
Right. Teachers and peers rated kids at age 8. Aggression, then. Linked pretty strongly to later smoking and alcohol use, especially for the boys. And the kids who became heavy drinkers later on, they were already seen as more aggressive and more of a behavioral problem in the classroom way back at age 8.
So it wasn't just a phase, it was a more persistent pattern seen early on.
It seems like those tendencies were identifiable quite young.
Okay. And you mentioned temperament earlier. Buss and Plomin's dimensions, activity, emotionality, sociability. How do those fit in?
Right, those 3 core dimensions. And there's this idea of a potential sort of linear path, temperament influencing personality,
Right.
which might then connect to psychopathology later.
Okay, let's break them down. Activity level, specifically hyperactivity.
Yeah, high activity level, especially hyperactivity, has been linked to later alcoholism.
Hmm.
But there's a big caveat. It often co-occurs with conduct disorder.
Ah, okay.
And researchers like Tarter suggested that maybe the conduct disorder is the more significant risk factor, and hyperactivity might just predispose someone to conduct disorder.
So not just high energy, but maybe restlessness plus rule breaking.
Something like that.
Yeah.
Then there's emotionality. High emotionality, that intensity and difficulty regulating, that's central to the difficult child idea, and it seems linked to potential problem drinking.
And that connects to Block's research, the anomic extroverts and unsettled undercontrollers.
Exactly. Block's long-term study described kids who later had drinking problems, often fitting one of those profiles. The anomic extroverts might seem cheerful, but had underlying negativity, while the unsettled undercontrollers were more irritable, maybe hostile.
So a surface presentation that hides deeper emotional issues. Okay, what about sociability? That sounds positive, usually.
It's complex. Tarter actually talked about pseudo-sociability, like being socially active, but maybe it's superficial, driven by impulsivity, not real connection or empathy, less about deep friendships, more about just contact.
That's a key difference, quantity versus quality of social interaction.
Precisely. And Gomberg's study, looking back with women who developed alcoholism, supports this idea of early emotional difficulties. They reported feeling more unhappy as kids, unloved, unfairly punished, emotionally reactive, plus impulse control issues like temper tantrums, even bedwetting.
So, a consistent theme of early emotional struggle and difficulty managing impulses. And Cloninger's study in Sweden, novelty seeking.
Yes, Cloninger and his colleagues found high novelty seeking that's wanting new experiences. Maybe taking risks and low harm avoidance, not being overly cautious at age 11, predicted earlier onset alcohol abuse. Reward dependence, needing approval, was also part of the picture.
Okay, quite a range of personality factors. Let's switch to psychopathology. Conduct disorder seems like a big one.
Definitely, that pattern of antisocial behavior in childhood is a consistent finding in people who later have substance use problems.
But Hawkins warned about false positives, right? Just because a kid acts out doesn't mean they're destined for trouble.
Absolutely crucial point. Lots of kids have behavioral issues early on and grow out of them. Hawkins stressed that these problems are much more predictive if they persist into adolescence.
Persistence is key.
Mm-hmm.
Okay, what about ADHD hyperactivity again?
Yeah, we touched on it as temperament, but the clinical diagnosis ADHD is also implicated as a risk factor for later alcohol abuse.
Oh, there's quite a bit of research there.
There is. Tarter's early work found adults with primary alcoholism reported more hyperactivity symptoms before age 12. Other studies replicated this, sometimes finding links to poorer neuropsychological test performance, too.
Suggesting potential underlying brain differences in some cases.
It's a possibility being explored. Alterman and McClellan broke down Tarter's checklist into factors like hyperactivity, impulsivity, attention problems, antisocial behavior, learning issues, and found many adult male alcoholics reported the childhood hyperactivity impulsivity factor.
Interesting how these overlap. What's the long-term outlook for kids diagnosed as hyperactive? Does it always lead to alcohol problems?
It's mixed. One study found higher alcohol use in adolescents after 5 years. But a longer, 20-year follow-up by Vice actually found no difference in adult alcohol abuse rates between formerly hyperactive individuals and controls, even though the hyperactivity symptoms often continued.
So maybe a link in adolescence, but not necessarily lifelong abuse, but other issues matter.
Exactly. August found that hyperactive boys with conduct disorder were much more likely to start drinking by adolescence. That combination seems particularly risky.
Right, and Hesselbrock's interviews. People with both alcoholism and antisocial personality disorder.
They reported way more childhood ADHD symptoms, hyperactivity, impulsivity, conduct problems, recalling things like being hard to get to bed, not responding to discipline, being overly aggressive, that whole cluster again.
Okay, a strong pattern there. What about emotional distress, anxiety, depression in childhood? You said it's trickier to study.
Yeah, it's hard to separate temporary states from traits or actual disorders in kids, but the idea is maybe early distress makes kids more vulnerable to using substances later to cope.
And the findings?
Coombs found adolescent girl drinkers were more depressed, had lower self-satisfaction. Gomberg's study found women alcoholics reported more childhood phobias, nerves, depression, even suicide attempts.
Significant links, especially in those studies with females.
And Oetting found emotional distress was indirectly linked to use, mediated by peers. And this interesting cultural difference. Anger linked to more use in Anglos, less use in Native Americans.
Culture really shapes things. Okay, shifting gears now to interpersonal factors. Family, that seems huge.
Absolutely critical. The research consistently points to things like conflict between parents and kids, negative or just inadequate parenting, parents using substances themselves, and a family history of addiction.
And specific parenting styles, like management.
Yeah, poor family management is a big one. Lots of conflict, inconsistent discipline, unclear rules or boundaries. There's also mention of a pattern with an over-involved mother and a maybe passive or distant father.
That dynamic. And parental modeling, obviously, if parents use drugs or are involved in crime.
Huge risk factor, absolutely. Yeah. Children with parents involved in crime, using illicit drugs, or with alcoholism themselves are at particularly high risk. McCord's work even identified specific family pathways, like a mom having high esteem for an alcoholic dad, or a mom unable to manage her young son's behavior.
So parental attitudes and control matter. Gomberg's study on women, family conflict and parental use were key, not so much socioeconomic status.
Exactly. It's more about the relationships and modeling, less about just social standing or family structure.
And Coombs found that mother-daughter bond was protective.
Yes. Daughters identifying with and depending on their mothers used less alcohol. Lower maternal trust, less encouragement, parental modeling of use those predicted higher use, and having clear family rules helped.
Werner's study again, alcoholic mothers posed a higher risk than fathers, especially if they drank during pregnancy.
That's what she found. And also, resilient kids were less likely to have siblings born really close in age, maybe suggesting more focused maternal attention was protective.
Makes sense. Comfort and DeMarsh listed key family risks. Glynn and Hainline stressed the positive relationship.
Right, that supportive connection as a buffer. And Brooks' longitudinal studies are really rich here.
Like maternal non-involvement predicting marijuana use, but maternal affection could offset early risks.
Precisely. Brooke found various parental risks like an emotionally unstable or drug-using mom or a distant drug-using dad, but also protective factors like the adolescent being conventional, the mom being stable and affectionate, a warm relationship with mom, closeness with dad. Importantly, early risks aren't always destiny. Later, positive influences can counter them.
That's hopeful. And Dishon's competent family management, consistent discipline monitoring.
Yes, key stuff. Good management linked to fewer problems, less early drug experimentation, low monitoring, harsh or inconsistent discipline, low parental acceptance of parental substance. Use those predicted early sampling.
But Block found family stuff predicted differently for boys and girls.
Yet, in their study, certain paternal traits like de-emphasizing competition, pushing early autonomy, fewer strict rules, and maternal traits low expectations, disappointment, anger, difficulty punishing predicted drug use for girls, but less so for boys.
Interesting gender difference. And Simcha-Fagan linked family issues more strongly to heroin use than marijuana.
Correct. Things like unhappy marriage, parental coldness were bigger predictors for heroin, and family antisocial behavior predicted the child's later heroin use.
And finally, siblings. Needle's study.
Can't forget siblings. Older sibs using substances were often sources and role models. Having substance-using older siblings increased a child's own likelihood of trying substances, especially if multiple older siblings used.
Okay, family is clearly complex and influential. Let's talk peers. We know they're huge in adolescence.
Huge. Though there's less research looking specifically at childhood peer relations predicting later use because peer influence really takes off in the teen years. And it seems stronger for marijuana than alcohol, generally.
But some childhood peer-related signs exist.
Yeah. Coombs found adolescent girl drinkers cared more about peer acceptance, spent more time with friends, talked problems over with them, a higher peer orientation. Oding found peers mediated the effect of emotional distress, and associating with drinking peers was a top predictor.
And the age of peers matters. Statton's study.
Right. Hanging out with older peers or working peers increased the chances and frequency of getting drunk for Swedish teens. Younger peers had the opposite effect.
So family might dominate childhood prediction for alcohol, but peers really ramp up later. What about early sociability and drug use?
Brooke found low peer isolation and low social inhibition in childhood predicted later marijuana use. Shedler and Block even suggested higher childhood sociability might link to moderate marijuana use later.
Maybe because marijuana use is often social.
Could be. And Needle found peer influence was stronger than parental or sibling influence during adolescence. Use was highest when both peers and older siblings used.
That combination effect. Hubbard found even in middle school, having peers okay with drugs or hanging with older teens adults increased risk.
Yeah, that exposure matters early. Which leads us right into Oding and Beauvais' peer cluster theory.
Right, the idea that the immediate friend group is key.
Exactly. They argue that getting involved with a small group of friends, a peer cluster, that uses drugs is the main trigger for adolescent use. Other things, family, personality, school, are background factors that influence who you hang out with.
So those background factors don't directly cause use, but push you towards certain peer groups.
That's the core mediational hypothesis. There are studies supported it, things like family strength or school adjustment affected involvement with drug-using peers, and that involvement predicted drug use. Even emotional distress seemed to work mostly through influencing peer choice.
Really highlights the power of that adolescent social world.
Okay, last major area, school. How does early school experience connect?
Poor school performance, low commitment to school, those are consistent predictors. Things like cutting class, not liking school, boredom, suspensions, dropout risk linked to higher adolescent alcohol use.
And persistent learning problems matter more than early struggles. Generally, yes. Problems that continue into later elementary seem more indicative. Gumbert found women alcoholics reported more school trouble run-ins with authority, truancy, suspensions, higher dropout rates.
Is there anything about cognitive abilities and family history of alcoholism?
Some research suggests slightly lower IQ or achievement scores in kids of alcoholic fathers, maybe some deficits in neuropsych testing, language, motor skills, but other studies found no significant differences. It's not entirely consistent.
So maybe subtle differences, perhaps more obvious in childhood, that contribute to school difficulties and thus risk.
Plausible. Werner found resilient kids had higher scores on IQ and academic tests. Peel proposed a model where maybe cognitive issues in kids with alcoholic heritage lead to hyperreactivity, making them prone to psychopathology and substance use as a coping mechanism.
A complex interplay. And it's not just grades, but overall school adjustment.
Right. Halikas and Rimmer found poor school adjustment differentiated polydrug users early on. Tomas included things like truancy and suspensions in an early misbehavior scale linked to later IV drug use. Even teacher reports from early grades predicted drug use years later.
Wow! Although the Woodlawn study had that surprising finding. Higher readiness scores linked to more later use.
Yeah, that suggested maybe early school readiness and social maturity could, in some contexts, correlate with earlier experimentation. And Almquist in Finland found lower school achievement was a risk factor for later psych treatment, delinquency, and substance abuse.
So overall, like Jesser and Jesser suggested, maybe poor school performance isn't the cause itself, but a sign of a broader pattern of deviance or unconventionality.
Exactly. It might be one manifestation of a tendency towards various problem behaviors.
Okay, we've covered a ton of ground. Before we finish, the paper had some important caveats, didn't it? About prediction.
Absolutely critical. Predicting future behavior is probabilistic, full of potential errors. These risk factors improve our odds of identifying kids who might be vulnerable, but they're not crystal balls. Always need context, collateral information.
And the huge difference between just using a substance versus abusing it or becoming dependent.
Yes, crucial distinction, based on diagnostic criteria. Experimentation, especially with marijuana, has become pretty common among teens. That makes predicting simple use from childhood traits really hard.
So these early factors are probably better indicators of potential abuse or dependence rather than just trying something once or twice.
That's the strong suggestion. Trying to predict mere experimentation based on childhood traits alone, you'd likely get a lot of false positives and false negatives.
Okay, so quick recap. Interpersonal risks include personality, the difficult child profile, aggression, impulsivity, maybe early emotional distress.
And psychopathology like conduct disorder and ADHD, especially when persistent or co-occurring. Then interpersonal risks. Family dynamics are huge conflict, poor management, parental modeling, history. Peers become incredibly influential in adolescence via peer clusters. And school factors like poor performance and low commitment signal risk.
And the main takeaway for listeners, these factors increase likelihood they don't seal anyone's fate.
Precisely. It's about understanding vulnerability and where support might make a difference.
Right. So here's a final thought to chew on. With all these early risks interacting and the huge power of adolescent peer groups, where are the best places to intervene? Should we focus mostly on shoring up individual kids early on, addressing those vulnerabilities? Or is the bigger leverage point in trying to shape the broader social environment, especially during those critical teen years? Or maybe both. It's complex. Something to think about. Thanks for joining us on The Deep Dive.